Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Okay, so I welcome one and all for the class tonight. It's a class on specimens, and as per special request by my students undergoing the practical exam. So let me start the class. I want everybody to participate. I want everybody to write down so that you also are able to speak in front of your examiners. Obviously, I know all my students, this batch is very, very shy. They don't like to speak in front of me, but you can at least write down. Okay, so try to answer with me when you can see the specimen, because then in that case you'll be kind of preparing for your exam. So let's start with the first specimen. I've tried to make them very simple. Can you see? What would be your language? I would want to see your language when you write down what exactly is the specimen of. Yes, come on guys, you can start. And obviously you will not get so much time in the exam, so you've got to be faster. Yes. Okay guys, come on. What would you like to write down? What does it look like? So until unless I get answers from my students, I'm not going further. Okay. So Shrishti, Kajal, Swati, everyone is going to answer. Yes, it is. Of course it is. But what and how will you speak? What will you say? It is hydrocephalus, yes, but that's the way. So here I've said image, but actually it should be a specimen. You can say like this also. This is a specimen of a neonate. Sorry. This is a specimen of a neonate with grossly enlarged head circumference, probably due to hydrocephalus. The scalp is stretched and thin, revealing prominent veins. Or what we can do is this way. Okay, I can just skip this. Specimen of a neonate with grossly enlarged head circumference. The scalp is stretched thin, revealing prominent veins. The cranial sutures appear widened, suggesting increased CSF accumulation. Facial features appear normal, no visible midline defects or cleft abnormalities. Rest of the body is proportionally smaller compared to the head, which is characteristic of a long-standing congenital hydrocephalus. So this is most probably a specimen of hydrocephalus. That's what you're going to share. That's what you're going to write down. You will say the specimen is showing a grossly enlarged head. The head circumference is enlarged. Scalp is stretched out, revealing prominent veins. Cranial sutures appear widened, most probably due to increased CSF accumulation. Facial features are normal. Also, you have to specify that because there's no obvious abnormality apart from enlarged head, which we can see. The body is proportionately smaller as compared to the head, and there are no visible midline defects, most probably suggestive of a congenital hydrocephalus. Long-standing, short-standing, you don't have to specify, but most probably a congenital hydrocephalus. That's the way you'll speak. So you'll first tell me what all can you see and why are you thinking is it hydrocephalus, right? So the possible causes could be that will be the next question. So why do you think? What are the causes of hydrocephalus? So there is congenital hydrocephalus, sometimes because of certain infections, sometimes because of hemorrhage, sometimes because of just other reasons. So one is due to aqueductal stenosis. Actually, that is the most common cause. Arnold-Chiari malformation, Dandy-Walker syndrome, both of which they have this problem of aqueductal stenosis, but that's not the only blockage. You can have a blockage of aqueductus sylvius as well. Okay, you must have heard foramina of Lashkar Mijindi earlier on, but there are two very important aqueduct. One is sylvius, one is your aqueductal stenosis. So they are equally and very important, most probably in Arnold-Chiari malformation and Dandy-Walker syndrome. Apart from that, you also have this in many other infections like toxo, CMV, rubella, yes. So that they also be correlated. What is the clinical correlation? So you have excessive head growth, bulging anterior fontanelle, sunset eyes, irritability, poor feeding, delayed milestones, and a lot of dystocia during birth, even if you plan off second trimester termination of pregnancy, or whenever you find this as a termination of pregnancy. Now, this is just easy quiz questions I've just kept to make you engaged in the class. So the most common cause of congenital hydrocephalus is the aqueductal stenosis. Okay. Then you have, which clinical sign in neonates with increased intracranial pressure? It's the sunset eye sign, which is most common. The gold standard imaging modality for diagnosing hydrocephalus, definitely the cranial ultrasound. MRI is gold standard. Ultrasound. See, the reason of why we need MRI is because we also can see the blockage, where the blockage is. All right, so MRI becomes the gold standard, but cranial ultrasound is very good in screening it, diagnosing it, and then the confirmation is with MRI. And that also sometimes tell you which is the place from which the pressure started building up, so we can get to know the place where the blockage is. Okay. Which shunt surgery is commonly performed in hydrocephalus? It's the ventriculoperitoneal shunt. This is one of the intra-abdominal procedures, the fetal therapy procedures which we do, fetoscopic. Name 2 torch infections, which I already told you. Toxoplasma and CMV are notorious in causing congenital hydrocephalus. And here's the next one.